Welcome to the studio once again. This time around, we're leading to our inset that has been prepared exclusively for our week, all the way from the US, representing the view of the World Health Organization. It's quite imminent. I mean, many people have the belief that in certain terms, Ghana is definitely not going to be able to make it or succeed in the maternal mortality MDG expectations. Here is what we're doing to ensure that we're putting our voice as part of their advocacy to ensure maternal mortality is brought to the barest minimum, completely eradicated from our systems. Let's take a look at this docu as part of our awareness.
A labor and delivery room in Gondar, Ethiopia. Health workers here are better prepared to deal with problem births, thanks in part to a massive international training effort. Ignafu Kutachu is with the World Health Organization, a partner in the initiative.
The program is called Improving Maternal and Newborn Health Survival, Skilled Care During Pregnancy, Childbirth, and in the postnatal period. That's the whole objective.
United Nations figures show that each year nearly 300,000 women die from pregnancy and childbirth-related causes. 1 million newborns die on their first day of life. Almost all of these deaths occur in the developing world, and most are preventable. Dr. Genet Geber-Medhin at the Gondar University Hospital says mothers here are the lucky ones.
What happens to the mother in labor who can't access or can't come to the health center is really a very huge problem. This can range from simple morbidities to maternal mortality or even to the loss of her child and her life.
By training skilled birth attendants, the UN Health 4+ program works to improve the health of women and children in 53 countries. Across Ethiopia and the United Republic of Tanzania, this joint initiative of 6 UN agencies and the Johnson & Johnson Company aims to reduce maternal and infant mortality and morbidity. The UN Population Fund's Philister Bwana is working to make sure problem areas in Tanzania get the help they need.
Training is important because there is, you need to build the skills. To build the skills of the personnel to provide a certain care. If we don't place them in the right place, there's no point of training them.
In Ethiopia, dozens of physicians and health officers are being trained at 10 sites across the country. Students and educators see a difference. Ngaidi Siam is a student at Gondar University Hospital.
When I was in the health center back in the past, sometimes I had to refer most to women that I could not handle or that I think it is beyond my training. So you will feel sorry because you couldn't help them. They may die on the way to the hospital. I was feeling so sad. I was feeling like I'm not useful there. But now I feel like I am so useful there.
When I see my students delivering a healthy baby and helping mothers, it makes me feel reassured that somebody is there to take care of these mothers.
It's one more step toward ensuring that mothers and children across East Africa survive childbirth. Deborah Doherty reporting for ETV Ghana's Awake.
Indeed, thank you very much. That came from Deborah Doherty. And today's has just been concentrating on Ethiopia with worldwide statistics on maternal mortality. Soon, it might just be your country, wherever you might be seeing us from. From this moment, or from maternal mortality and cabinet to infertility, we're going to be discussing. Now, in a layman's perspective, when we talk about infertility, people grossly will say to you, she's unable to carry a baby. She's unable to get pregnant. In rare cases, some people will say, well, she is barren. Here is the talk we're going to be initiating on infertility as well, on how we are supposed to be preventing or ensuring that women get fertile. I've been joined in the studio by Dr. Emilia Lane. She's president of Batampa Women's Hospital. Now, on a few synopses, the value for fertility rate, total births per woman, in Ghana was 4.10 as of 2011. Over the past 51 years, this indicator reached a maximum value of 6.96 in 1969 and a minimum value of 4.10 for 2011, which I mentioned earlier. Doc, you're welcome to the studio once again.
Thank
How are you
you
doing this morning?
Excellent. It's nice to be here.
Thank you so much. We miss you so much. Tell me, when they say a woman is not fertile, are we correct to say she is barren?
No, the word barren doesn't mean much, and it's obnoxious. It's derogatory.
Right.
And most women, really, we do not know they are infertile. Many women are subfertile.
Right.
So until someone has a baby 10 years later, which is much longer than her peers who got married the same time she did, you don't really know she's infertile.
What is subfertility?
Subfertility means she's not as fertile as someone else. So infertile, you really cannot say till the person's lifetime of trying is over. And generally, we say someone is infertile when they've been trying in a marriage for at least a year and they are not pregnant. But really, it's a strong word because many of them just need a little help and they might get pregnant.
Wow. The World Health Organization also defines infertility as the inability to conceive a child. A couple may be considered infertile if, after 2 years of regular sexual intercourse without contraception, the woman has not become pregnant and there is no other reason such as breastfeeding or postpartum amenorrhea, right?
Yes.
Doc, please tell us again, how is infertility treated?
How is it treated? Let's look first at what happens to get fertile because I think that explains, it
That's the
immediately
treatment, isn't it?
explains how it gets treated because there
Right.
are many areas. Can I have the age graph first? The
All right.
very first thing I'd like to say is people should be trying to have babies sooner than later. Because if we can show our age graph, you'll see that your fertility drops with age, just
Right.
naturally. It drops pretty
We have
fast.
the graph here. The graph,
Pretty fast
sorry.
after age 35. The births to each woman in that the age groups under 35, you can see are around 4 per thousand, around 400 per thousand. And then as soon as you start hitting 35, it drops sharply. So that's the very first factor. And remember, we are going to assume for now that the man is not the problem because it takes two to tango. You need two people to have a baby. And the very first thing to exclude is that the man is not the reason why the woman is not getting
Is it still
pregnant.
so now?
It is still so, very much. In about a third of the cases, it's a problem with the man and not necessarily the woman. So let's look at the normal cycle, the picture of the normal cycle, and then we'll show the factors that it takes to have a baby.
That is it?
And no, this is
This was
graph.
the earlier one.
Yes. We want the normal cycle. And you'll see that a woman needs to produce an egg once a month, what we call ovulation, which usually happens about 2 weeks before your period.
Right. Unfortunately, we do not have the next draft or graph, and we might have to just continue
Well,
that way on what is supposed to be
We
done.
need an
Continue,
egg.
Doc. Right.
We need an egg. And then we need a tube which is open to carry the sperm to the egg and then the fertilized egg back into the uterus. It's actually a journey of the sperm all the way down the tube. Fertilization occurs near the end of the tube, and then we need to journey back into the uterine cavity and then implant inside a cavity that's prepared like a thick nest
Right.
for the baby to implant and grow well in. So what do you think could go wrong here? One, maybe she doesn't produce eggs.
Right.
In Ghana, unfortunately, the biggest problem is the tube is not open. Most of the time, this is from infection, usually sexually transmitted diseases. It can also be from something called endometriosis. And then the final reason is if they've had surgery, someone who had a ruptured appendix, and maybe it ruptured and infected her whole abdomen before she got treatment for that appendix, may end up with scar tissue. So any of these three reasons, either sexually transmitted disease or endometriosis or any other abdominal infection or surgery, could cause scar tissue. So the tube is not open. So the sperm and the egg cannot meet.
Are all of these supposed to be considered when a woman is not fertile or considered infertile?
Yes, all of those should be considered. Is she making an egg regularly?
Right.
Is her tube open? And then Is her uterus normal? Sometimes there are different shapes to the uterus. A few people are born with abnormal shapes. But in Ghana, a huge problem is what we call fibroids. These benign, non-cancerous
Okay,
muscle
so we have
tumors.
the next bit.
Okay, this one shows the abnormalities of the uterus that people are born with. Some people have a double uterus. Some people have like a dividing partition inside the uterus, which doesn't help the egg to find a good place to implant. Or they get pregnant and they miscarry very easily. So these are the abnormalities people are born with. But if you show the one with fibroids, which is a common problem here, especially as people get older, can we show the slide with the fibroids, please? You'll see that that can also obstruct the cavity and prevent either the sperm from even meeting the egg or the fertilized egg from implanting back into the uterus, just because there are so many nooks and crannies instead of a nice normal cavity.
With the division of the uterus, isn't that to say there could be good fertility over there with the production of a multiple conceptions?
Not necessarily.
Right.
That has far more to do with egg production than the shape of the uterus. The uterus, remember I told you, the sperm travels down the tube and joins the egg in the tube, and then they travel back together after they join. So by the time they approach the uterus, really the union has formed, and it may subdivide or not, but that happens elsewhere.
All right, we have yet another one on the screen. Could we have a brief explanation?
Well, this is the earlier one I wanted, showing you that the egg is popped from the white part, which is the ovary, into the tube. And then the sperm meet it towards the end of the tube. The tube has to be open. It has these fingers which pick up the egg, and the sperm meets it there, and they travel together after they've started dividing, and then they go and implant inside the uterus where the lining has been thickened. Sometimes there are people whose lining does not thicken as well as it should. So even when the egg meets the sperm and it multiplies, it gets to the uterus, and the uterus is not ready. It's not a comfortable place. That's called luteal phase problems. And then that's something else that needs to be treated separately then.
All right. If you just joined us, we're treating infertility. Obviously, at the end of this discussion, we're going to be giving clear ways, free consultation, I'd like to say, with Doctor this morning on what we're supposed to be doing to treat infertility or to get fertile. Usually in our communities, once a woman doesn't have a baby immediately after marriage, quite a number of people are easy to pass comments. Indeed, the most difficult bit could also be where clearly the woman is to blame, which has nothing to do with the man at all, which she tells us is still in existence. Again, if you just joined us, join in the discussion, facebook.com/ETVAwake or 1821 for Airtel subscribers or 1721 for other networks. Right, so we were on treatment.
Okay.
Now that we've gotten to understand how infertility can be caused, how do we consider treatments, if any?
So typically, within the first 3 months of approaching your doctor, he should exclude a male factor, make sure it's not the man, because then it has nothing to do with you. And once that is done, then we need to make sure, are you producing eggs? So lots of people are used to the concept of taking pills or injections to help produce eggs. Sometimes it's like your ovary is lazy and it needs to be pushed a little harder to produce eggs. And we do that, especially in these days where with a burgeoning middle income, a lot of us are getting overweight. We'd have more problems with producing eggs.
But Doc, is there the possibility of a woman menstruating yet does not produce eggs?
I would say there's a possibility of a woman bleeding somewhat regularly. But if you pay close attention, you'll realize she's not following a normal cycle. Maybe she bleeds once in 2 or 3 months or 6 weeks. Anytime someone does that, there's a problem.
Let's take a look at the picture.
Ovulating regularly.
Let's take a look at the next picture. Right.
Well, this next picture is actually showing you the scar tissue that comes after pelvic inflammation or STDs. And you see how everything is knotted up and matted together and swollen, and the ends of the tubes are blocked. No matter how many eggs you produce, this lady is not going to get pregnant because the egg cannot meet the sperm.
Until they are unblocked.
Exactly. Until they are either unblocked or most likely in a case like this, it might be better just to bypass the tubes and do what's called in vitro fertilization, where the reproductive specialist will just pull the egg out, join it to the sperm, outside in a little petri dish and then put it back inside the uterus. So we just bypass the
How
tubes.
wonderful. Okay, which is quite common lately anyway.
Yes.
All right, so let's go on with the treatment.
It's available now. So we started from making the woman produce eggs one way or the other. You can unblock the tubes either surgically or bypass them with in vitro. If the man's sperm count is a little low, sometimes they can be washed and concentrated and then deposited inside the uterus, which gives them like a shorter journey to travel. It makes their job a little easier.
Right.
So that also improves the chances of getting pregnant. The other thing is sometimes the uterine lining needs to be improved. These people form the fertilized egg, but the lining, when they arrive, the nest is not perfect. So we can optimize it, again, by giving certain drugs like estrogen and progesterone, so the lining is thick and the fertilized egg is happy to settle in there and grow.
All right. So, I mean, what would we say to the many people out there who say there is no such thing as infertility now, as, I mean, there's been this sudden patronage of in vitro fertilization, or IVF you might want to call it, and once this is neatly done and put back, a woman is supposed to bring forth. And here is why we have witnessed the birth of multiple babies in our systems.
That is not true.
Right.
That is a delusion. The first thing I'd like to say to people out there is, one, have your children sooner than later. Don't waste too much time. If a 22-year-old gets married and wants to enjoy her husband for 2 years before starting a family, that's perfect. But if you are 32, I would beg to differ. I think you need to be getting on with your business, because you saw what happened in the first graph. Can I have the second graph, please?
Okay, so let's take a look at the second graph.
What it shows is that after 35, it doesn't matter what the in vitro guide does.
Right.
If you use your own, the woman's own eggs, unlike men, we are born with all our eggs. So by the time you are 35, your eggs are 35 years old. We would like the graph, please. A man keeps producing brand new sperm which are healthy and active. Yours have been in the freezer for a long time. They are chipped and cracked and broken. So even if you can get pregnant, you are more likely to end up with children with abnormalities like Down syndrome or other chromosome problems. So if you are older, the in vitro people can help you. But it's far better for you to find a donor egg. So a young sister or cousin maybe to give you an egg, and suddenly you are as fertile as anybody else. But that's because you have a young egg. If you use your own egg, the success rate is not good, even with in vitro fertilization.
Under what circumstances, indeed, are we supposed to be giving eggs to other women to carry? Then I think this opens another chapter we're supposed to be discussing. But let's take a look at the very first graph we saw on screen for further explanation by Doctor before we continue on this. First draft. First graph. Hey, why am I forgetting? All right, so we have it. There we go.
That's the graph showing you how fertility drops rapidly after 34, 35. And in fact, if we had the graph of infertility women's treatment, you would see that even though this happens when women use their own eggs, if they use donor eggs, the rate stays right up there with all the young women. Okay, so if you are older, I would highly recommend that you do consider donor eggs. People are sometimes not open to the idea, saying it's not their own genes and all that. If you can find a younger sister or cousin, or even a donor, a healthy nurse, someone who's been screened for diseases, who's willing to donate, you will improve your chances of carrying a baby and enjoying a child for a long time.
All right, so at the right time, we're going to be looking for a psychologist who knows noted here to be giving us an insight into the psychological effects of infertility treatment. Usually when you go to our hospitals, there are quite a number of women who are lined up for various reasons. But if you go in depth, you realize there are many others who are just wanting a single cry from one baby they might just be looking out for all their life. How is it like lately with issues of infertility, especially in Ghana? What do you think might just be leading to it? You know, there are many others who think that once a woman is infertile, it could just be as a result of her past abortions, unsteady sexual relationships, and so much more. What do experts say?
One thing I would say is that the part about the tubal factor being the biggest factor suggests that infection is huge. Unfortunately, as a developing country, we do not routinely screen young women every time. They don't even get pap smears. But if they did, they would get routine screening for sexually transmitted diseases. So they would get treated. Unfortunately, many women are not symptomatic. They don't know they have a problem. And by the time they figure out that they have a problem, it's too late. That's when they have a baby. And let me put in a plug while we're having this discussion, that people should always consider adoption too. Not spend all the years working on infertility, 15 years working on infertility. They could have been enjoying an adopted baby for 10 years.
Doctor, but I think we should be getting practical about this. I was just speaking to a young lady of about 15 years. How many children would you want to have? And she said to me, when I get married, I don't want to have babies in the first place. Why? Because there are just many children on earth who are suffering already. Why would I want to have a baby? And then another woman said to her, it will never be the same as a baby you have carried in your tummy for 9 months. Clearly, by this, do you still preach or advocate adoption as opposed to in vitro fertilization?
I do. In vitro is out of the reach of many people, simply financially.
Right.
It's available, but it's out of the reach of many people. So we have to be practical. It's the same way that some women will never consider a donor egg because it's not their genes. But at least you get to carry that baby for 9 months. And you get to consider it your own, especially if all the legal papers are done well. So sometimes we don't get exactly what we want. Of course, we all want the very best. We all want to be the most beautiful, brightest, talented. Life is not like that.
Yeah.
Sometimes we don't get everything we want, and we have to settle for the next best thing. And I think adoption is a really good way. And in some cases, especially where there's something called unexplained infertility, they've